this is Anita with Simply O3, and today I am going to demonstrate how we are going to transfer IV fluids from a saline bag into a compounder bag. So this compounder bag actually has a transfer tubing here with a spike adapter, and what I'm going to do is open up my IV tubing, and with my spike adapter that we normally put the IV tubing into is how I'm going to attach it to my saline bag. So now that I have that on there, all I need to do is drop my bag and fill it up. And with the major autohemotherapy that we want to give is 120 is our starting baseline for saline. So I'm gonna add up to 120 cc's of saline, which truly is kind of an estimate here. I'm gonna go down a little bit. And then at this point, what I'm gonna do is lay it down. There's this clasp here that I'm gonna close it with. And then the TPN bag comes with a cap. And that cap, when I take this off, and if I was gonna add another one, then I can add this to the end of that. But today what I'm gonna do is go ahead and remove this. Here's my cap. And now I have my bag of 120 cc's of saline here, and I'm gonna add my heparin to this bag. Okay, so next step is we are going to add heparin to our saline bag. I've got a 1,000 units per ml mix here, and I'm gonna go ahead and pull up 2,000 units. Now the protocol says for 2,000 to 5,000 units of heparin. It's really individual preference of the provider, depending on how much heparin they want to add and what protocol they're going to use. But today I'm going to do 2,000 units of heparin and add that to my bag here. It's helpful if you have that pre-mixed with your heparin and let it sit there for a few minutes to prevent coagulation, or clotting I should say. And then the next thing I'm going to do is go ahead and prep my tubing just like I would any other regular IV. This one has, oops, I'm just throwing stuff all over the place. So we're going to spike our tubing and prime our bagging as we would normally with IV tubing. Okay, I just started her IV, and what I'm going to do is attach the tubing. Put on my outside. And then grab my bag and unclamp it, and then drop it below the heart. And you can see that it's coming down here to the bag and going to, by gravity, fill up this bag. And what we want to collect is 200 milliliters of her blood. So we started with 120 milliliters of saline, and then when we add the 200 milliliters of blood, then we will have a total of 320 in our collected bag here. So it usually takes about 10 minutes to collect. Okay, so it took about 10 minutes. We collected 200 milliliters of blood. Remember, we started with 120 cc's of saline, so we're at 320 now. I clamped the tubing, and I'm gonna put it back up onto the pole, and then come over to the ozone generator to create the ozone gas. A couple things with the unit. The AC adapters on the side here, and then the oxygen is attached from the oxygen tank to the back of the generator. The Simply O3 regulator is a pediatric version of a regulator. So with that, you get smaller increments of liters per minute from 132 to 116. I'm gonna set this at 1/8 of a liter per minute because when I come over here to my generator, there is a scale on top, and you use the scale to determine how much oxygen liters per minute you're going to use, and then what you're gonna put your generator setting at. This is Jessica. She's had the infusion many times, so we're gonna do a 69 on her. So actually, the oxygen is at 1/8, and then I'm gonna set the generator at 10. This piece here comes on and off. It's your ozone out. So I'm gonna plug that on, and what this does is it allows the ozone to go into the silicone tubing, into this destruct, so that you're not breathing in the ozone gas, and it's safe to be having this in your environment where you're not gonna be breathing it in. And then the next part is to use ozone syringes to collect your ozone gas. So these are silicone only syringes. The syringes that have the black rubber stopper, the ozone gas will tear that black rubber apart. So that's why you want to use the ozone gas syringes. We are going to collect a total of 200 milliliters of ozone gas. And so that's what we're doing here is it's a stopcock, three-way stopcock, and the ozone gas is going to start to autofill into the syringer. And as you can see, it's clear, colorless gas. It does have a scent to it. It's okay to smell it. It's just not okay to breathe in large amounts, especially over time. But smelling it is okay. Some people don't care for the smell, but it is okay to smell. Okay, so I collected a total of 3 60 ml syringes, and the last one is at 20 because I need a total of 200 milliliters of the ozone gas. And then I'm gonna turn off my generator, and I'm gonna turn off my oxygen so it doesn't leak out the oxygen. What I also did was on top of here, I placed it's called a scalp needle set, and essentially what it does is, I'm gonna actually set this up. Ozone gas is heavy, and so you want to, when you're handling it, set the syringes upright so that it doesn't escape if you put it on its side. And so this right here is what I am using. It's a butterfly needle, a 23 gauge, and it has this extension set, and then I add it to the end of the lure lock. The reason why we use a 23 gauge is when you start using a smaller gauge or larger gauge needle, the blood that I'm going to, if I had a larger gauge needle, what would happen is, see how the blood's coming out, a lot more would come out. But in this case, what I'm gonna do is actually inject the ozone into the bag. You can see the bubbles up there. And then I just kind of occlude it, the tubing a little bit, grab my next. And it just goes directly into the bag. Inside of the bag, it is binding with the hemoglobin in the blood. And so that's how it's going to get mixed into the blood and then re-infused into the patient. So I've added my 200 milliliters. And then I take it off of the hold here. And the next thing we do is just gently mix that. And you can see that the blood is turning a little bit brighter version of the blood that we pulled off by gravity. Put this back onto the pole, and then you can go ahead and open up your stopcock and reinfuse the now ozonated blood into the patient.